What is a biopsy?
So there's several different kinds of biopsies that can be done. Um, it sometimes, but rarely, if there's a lump in the breast, um, what what is called an aspiration can be done, and that really is when on exam, on imaging, most notably an ultrasound, that it looks like this lump in the breast is really a little sac called a cyst filled with fluid. And under those circumstances, a fine needle aspiration can be done. And in a fine needle aspiration, it evacuates the fluid, and cells can be looked at under the microscope, but these cells are usually single cells, and it is frequently very hard to make any kind of a cancer diagnosis on a aspirate. If there is a high reason to believe that the lump in the breast is a cancer, a malignancy, right now the standard of care is really to do what is called a core biopsy, and core biopsies are performed either by general surgeons who manage breast cancer, by breast surgeons, or by interventional radiologists. And a core biopsy means that a needle that can pull out an actual little piece of the mass, of the tumor, that can be used for complete diagnostic purposes. So this little piece of tissue would be able to tell you whether it is in fact a breast cancer, what kind of breast cancer it is, and usually from these core biopsies there's enough tissue to do what are called biomarkers that are so important for planning the treatment for the breast cancer. So that would include estrogen receptors and HER2/neu assessment. There's another kind of biopsy called a stereotactic core biopsy. So stereotactic core biopsies are done when there is no mass lesion, but a mammogram simply notices something that the person, the patient, or the physician cannot feel. And most frequently, this entity would be microcalcifications. Little specks of calcium in the breast are frequently a hallmark of a very early cancer, but you can't feel anything. So a stereotactic core biopsy means that a core biopsy is done under the direction of a very specialized mammogram. So this mammogram localizes where the little specks of calcium are, and then the radiologist is directed with a core biopsy needle right to that area.